You've probably heard someone describe some awful pain and then say, it was almost as bad as passing a kidney stone. Well, there's a reason for that. It's one of the most intense experiences a person can go through. But here's the thing, it's often preventable and it's definitely treatable. So in this explainer, we're going to break it all down using some great guidance from the experts at Arka Anugraha Hospital. All right, let's start at square one. What in the world are these little things that can cause so much chaos? Because, figuring out what the problem is, that's always the first step to solving it. Oof. If that question just gave you a flashback to a pain you'll never ever forget, you're definitely not alone. That sharp, radiating feeling is pretty much the classic calling card for a kidney stone. So let's get into what's actually happening inside your body when that hits.
Okay, so picture this. Your urine has all these dissolved minerals and salts just floating around. And usually, your kidneys flush them right out, no big deal. But if your urine gets too concentrated, which usually happens when you're not drinking enough water, those minerals can start to crystallize and clump together. They form these tiny, hard stones. It's kind of like making rock candy, Except instead of a tasty treat, you get a whole lot of pain.
Now here's where it gets really interesting. Not all kidney stones are created equal. Nope, there are actually 4 main types, and figuring out which one you might be dealing with, well, that's the secret sauce to preventing them from ever coming back. So let's put on our detective hats and figure out the why behind each one.
So take a look at this. The huge majority of kidney stones, we're talking a massive 70 to 80%, are calcium oxalate stones. So, statistically speaking, if you've had a kidney stone, odds are it was one of these. But what about the other guys? Well, each one tells a completely different story.
All right, let's run through the lineup. First up, those super common calcium oxalate stones. They form when calcium links up with oxalate, which is found in foods like spinach and nuts. Then you've got uric acid stones, which are often connected to things like high-protein diets or gout. Struvite stones are a bit of a nasty one. They show up after urinary tract infections and can get huge really fast. And finally, you have the super rare cystine stones, which are actually caused by a genetic disorder.
You hear about gallstones too, and it's so easy to get them mixed up, but they're totally different things. The number one difference? Location, location, location. Kidney stones form in, your kidneys, and the pain is usually in your back or side. Gallstones form in your gallbladder, which is tucked away under your liver, and that pain hits you in your upper right belly. So yeah, different plumbing, different problems.
Okay, so we know what they are. We know they come in different flavors, but how do you really know if you have one? Spotting the warning signs early is absolutely the key to getting help, and fast. The textbook symptom is a really severe, cramping pain that comes and goes in waves. You might also see that your urine is pink, red, or brown, or maybe it's cloudy or just smells off. Nausea is really common too. But listen up, because this next one is the most important. If you get a fever and chills with any of these other symptoms, that's a huge red flag for a serious infection. You need to see a doctor immediately. So, when you get to the doctor, how do they know for sure? They'll use imaging. A CT scan is what they call the gold standard because it gives them this perfect, super detailed picture of the stone's size and exactly where it is. An ultrasound is another fantastic tool. It's quick, non-invasive, and really effective for making a diagnosis.
Right, we've talked about the what, the why, and how to spot them. Now for the most important part of all, what can you actually do about it? Let's get into your toolkit for health, both for treating them and, even better, for preventing them.
How a stone is treated really all depends on its size. If it's a little one, the game plan is usually pretty simple. Drink a ton of water, take some pain meds, and let your body pass it on its own. For bigger stones, there's something called ESWL. It basically uses focused sound waves from outside your body to break the stone into tiny pieces you can pass. Other options involve going in with a tiny scope to grab the stone, and only in rare cases with really large stones is a type of keyhole surgery needed.
Look, it's great to know all these high-tech treatments are out there, but wouldn't you rather just not have to deal with any of this in the first place? Yeah, me too. When it comes to kidney stones, that old saying is 100% true. An ounce of prevention is worth a pound of cure.
And the best part is, you have so much control here. Tip number 1, and it's the biggest one, hydrate, hydrate, hydrate. Water dilutes your urine so those minerals can't clump together. Limiting salt is also a game changer because too much sodium forces your kidneys to put more calcium into your urine. Same goes for animal protein. And now for a surprise tip, don't skip the calcium. Getting enough from your food actually helps because it binds with that oxalate stuff in your gut before it can even get to your kidneys.
So, let's wrap this all up. After going through the types, the symptoms, and the treatments, what are the big, empowering takeaways you can use to take control of your health?
When you look at the advice from top specialists, you see it's not just about fancy machines and procedures. It's about empowering you with knowledge. It's about taking what we know today and using it to build a healthier tomorrow. It's about combining that cutting-edge treatment with a real focus on you, the patient.
You know, the best weapon we have against kidney stones isn't a machine, it's knowledge. Decades of experience from specialists like Dr. Manohar CS have basically given us a clear roadmap. The best defense is simply understanding your own body and what your personal risk factors are.
So, if you remember just one thing from all of this, let it be this. If you've ever had a kidney stone, find out what type it was. That one little piece of information, that is the absolute key to unlocking a prevention plan that is tailor-made for you and can help you stay stone-free for good.
So I'll leave you with this thought. Now that you've got the tools, what is one small, simple change you can make starting today to protect your kidneys for the long run? It doesn't have to be some huge life overhaul. Maybe it's just drinking one more glass of water. Maybe it's swapping out a salty snack. Whatever it is, that one small choice is an investment in your future health.